Can you hear me now? Can you see me now? Please text in the chat. Can you hear me and see me? Okay, finally we do it. Okay. Nice to meet you, everyone. Yes, and let's start. Yes, at first, my friends, I would like to say that my English language is not my native language. Yes, I've been learning a lot English, but I do mistake, a lot of mistake, and you can smile, but not judge, but without judgment, please. Yes, and I'm really expert, and I think that I hope you will find my content is very useful for you. And if you don't like it, you always can leave from this webinar. Okay? You can hear me? I can see. Okay. Please restart your website. Yes, where you are watching me. Yes, see and hear anything. Okay. There is no sound. Sorry. Yes, but maybe restart the website. Restart webinar, please. It could help. Yes, refresh the screen, please. We can hear you. Okay, yes. Okay, let's start. Yes. Sorry for my English, it's not native language for me, but yes, I'm trying to explain my content and I think it will be very useful for you. Okay, we can start. Friends, welcome to my webinar. Today we have a very exciting topic. I'll show you how you can look 5-10 years younger by working not only with skin and facial muscles, because it's common. Yes, you can see a lot of, you can watch a lot of techniques, and I show also a lot of techniques where you can work with the muscles, with the skin. But we can also work with deep structures, and we can work deeper with the skull bones. And it's very powerful, and I would like to explain in this webinar why it's a good way to make yourself more younger. Yes, and you'll be surprised to learn just how much our appearance depends on the bones of the skull. So let's start. Okay, and at first I would like to introduce myself. My name is Alice Ulishchenko. Yes, I'm a doctor, and I'm an osteopathic physician and orthopedic doctor. And before, yes, I was working as a surgeon also, and I've been working. I was working at almost 6 years as a surgeon, and I did many operations, and I've got a PhD degree in medicine. And now I'm founder and mentor. I'm founder and instructor of the Mind Body Face Academy, where you can study. Yes. Okay. Next. And for me, interesting, who came here from my social media? Please text who follow me and where you watch my videos. Yes, a lot of, yes, thanks. Okay, and did you do some exercise which I post? Please tell me. Okay. Okay. Before we dive into today's content, I would love to know you better. And please type in the chat. What is your name? How old are you? And where are you from? And about myself, I'm 35 years old. I'm living in Dubai. Originally, I born in Ukraine. Half-life I lived in Ukraine. After I lived in Moscow and I studied in medical university in Moscow. And last 4 years, almost 4 years, I've been living in Dubai. Yes, and I've got a medical license also in Dubai, and I'm working in clinic in Dubai. And I see my patients every week. Yes, and you can schedule appointment with me if you come to Dubai. And yes, and I can work also like hands-on. Okay, Susan Holland, Tracy, Germany, Amber, Madrid, Spain, Mexico, Iris. Okay, nice to meet you, all of for everyone. Morocco, Egypt, Thailand. Okay, nice. It's very nice because I see that people who came to this webinar from all worlds. Okay, what's going to happen today? And why it's important to watch it till the end. Yes, it's very important to watch this webinar to end because it will be many useful content. At first, the hidden you'll know the hidden factor of use, the main mechanism that determines how you will look in 10, 20, and 30 years. We do diagnostic tests, find out your signs of aging. We'll do practice, 3 simple techniques to prolong your use by years. Try them live. These techniques are not freely available. Yes, you can do like these techniques with me in live. And I'll see transformation cases also in life and inspiring stories of women who have changed their face and lives, and answer to your most pressing questions live. Okay? And I'll share what's especially important to me personally. I'll tell you about my new original course, the most profound and powerful course I've ever created. And you didn't see this course before, and I present this course in at first in this webinar. Yes, and yes, I'll give you like an incredible offer for this course. It's very important. It's a very powerful course. Okay, and please stay until the end. Last minute, I'll give you best bonus. Yes, it's what is it? It's I'll give you a special bonus video tutorial on buccal massage. This is a paid training that I normally sell, but today everyone who stays until the end of the webinar will receive it for free. Yes, I'll give you for free. Please stay with me to the end in this webinar, okay? And we start. I would like to check your condition now. Please rate how you are feeling right now on a scale from 1 to 10. How would you describe your current emotional state, please, from 1 to 10? For me, it's very interesting. Okay, please. Okay, 9, 9, 8, 10, 8, 4, 6, 7, 8, 10, 10. Oh, nice. All of you are good condition, I see. But someone no, yes, like 4, 5. Okay, how would you rate your appearance? Okay, about appearance from 1 to 10. How would you rate your appearance? 5, 4, 6, 6, 6. I see that most of you are suffering about your appearance more than about your emotional condition. Yes? And how much do you love yourself? It's also interesting. From 1 to 10, right? Okay. 8, 5, I see 7, 10, 8, 4. Okay. Nice. Please take this seriously because this is a truly profound topic that are directly connected to your face, your beauty, and your confidence. And all these things are an interconnection between each other. It's very important because of course I also consider and compare like body condition, physical condition, emotional condition, and appearance. It's a connection between each other. Okay, and next, okay, how do you think? What are you feel, or what are you missing to feel 100%? And I have like some options for you, like vigor and energy, like self-confidence, self-love, regular self-care, or your own options. Just tap in the chat, please. Okay. Self-confidence, my posture, regular self-care. Yes, I see confidence, my pains, energy, more money to pay. Other, yes. Face structure, self-care, stronger, less wrinkles, weight. Okay, it's and all of you text me. Yes, all you answer accompanied with appearance also, and with your like inner condition, and we will work with this. Every woman is naturally beautiful, and to unlock your inner potential 100%, you need health, self-love, and a little curiosity. Yes, because fully unlock that beauty in your life's potential, you need energy, health, and self-love. Yes, and my mission is support you on this journey and help you become even healthier, more radiant, useful, and confident. And if you work with your body, with your face, you'll get it, really get it. Okay, and we start with first point, the hidden factor of use. And now I'm moving to a topic where we'll explore these factors, all of this. Okay, and I would like to ask you, how do you know if a face looks younger or not? Write in chat, please. Really, how do you know if you like look people? Yes, how do you know? Are they younger or no? Sagging neck area, loose skin, emotionalized lines, sagging because of drooping muscles, fine lines. Yes, yes, wrinkles, jawline, firm skin, tired, wrinkles, and double chin. Yes, I agree with everything. Yes, jaws, energy. Yes, there are many subtle details to consider, and it will be interesting to discuss. Yes, with them the next slide, and I see you. Let's start with Madonna. You can look at her photos at different ages. Yes, 3 photos in different ages, and in the most recent ones, you'll notice that even after plastic surgery, because she got a plastic surgery, yes, and even without wrinkles, she still looks older than 25. Are you agree with me or no? Yes or no? Look at first picture, left picture, where she was young, and last. Yes. Why? Why? Madonna hasn't wrinkles, but she still looks older than 25. Yes, really. Okay, next example. You can see the tissues are filled with fillers, but it doesn't make the face look younger because there is no filler in the volume of the skull bones. Yes, also, are you agree with me? She looks older than 25 also, yes? In left photo. Bone structure, yes, someone texted. Okay. Okay. The best thing you, and indeed, through my many years of practice, I come to realize that what truly reveals age is the skull and posture. In real, it's skull and posture. Even there are no wrinkles, if you don't see any wrinkles, and the skin appears smooth and radiant, it's the shape and structure of skull that give away a person's age. Yes, it's very important, skull and posture. If you have problem with the skull and with posture, and even if you don't have any wrinkles, you looks aged. Are you agree with me? Yes or no? And you can see like why. Michelle Pfeiffer, 64 years old. Her skull retains the natural fullness of her face and holds the tissues in place, preventing them from withering away. Yes or no? Could you see that in 64 years she still look younger, in really more younger than other? And here is a great example, Jennifer Lopez, 55 years old. You can clearly see how good posture and good postures and long neck and well-preserved skull structure help her look truly youthful, even she's 55 years old. This perfectly illustrated what I'm talking about. It's not just wrinkles that reveal age. Posture and shape of the skull play a huge role in this. Are you agree with me? Yes or no? Yes, really, skull and posture is very important. And yes, it's true. There are many other tools that can help. Yes, there are many tools that can help, many techniques like massages, tapes, creams, Botox, but most of them works only with superficial level, on a superficial level. If you learn how to work with your posture and the bones of your skull, you'll see long-term results that last for many years. It's really, if you will study how works with the skull bones, yes, you can see you'll see like long-term results. That's because all the structures in the face are attached to, because all structure like skin, muscles, fat attached to the skull bones and depend on the position of the cranial bones. Okay. And interesting fact about me. 10 years ago, I was working as an operation surgeon. Really, from 2013 to 2019, I was working as as a surgeon, and including performing reconstructive plastic surgeries, and I also studied cosmetology, and also studied how to do like injections, Botox. But even before that, during my time in medical university, I was already studying osteopathic medicine, because I've been practicing and I've been osteopathic medicine more than 15 years. I studied osteopathic medicine from in 2007, 2008, and that gave me a deeper understanding of how everything in the body is connected. Because like cosmetology and plastic surgery, it's I like it, and it's also these techniques also work, and gives a lot, but this work with superficial layer, and for me all time I was interested all time about like more deepest work, and osteopathic medicine gave me understanding about it, and I always had a desire to create a method that is natural, safe, and effective, method that could reshape the face without surgery. And that's how I developed my own technique. It's called natural faceplasty techniques, which works with the bones of the skull to make the facial structure look younger and more beautiful. And this webinar, it's about natural faceplasty techniques. And I guarantee you, if you follow my recommendation and practice the exercise for just 1 to 3 months, you will see amazing results, completely safely, without scalpels and risky injections. Okay, tell us please, what did you try and how long did the results last? After massages, tapes, face yoga, Botox, or your own version? What did you do already? Botox 4 months, yes, okay. Massages. Okay, I think you did many things, yes, and you know many things, yes. Okay, face yoga only, massage, face tape, face yoga. Okay, okay, and I would like explain. I would like tell you about the maxilla, because why is it called the beauty bone? How do you think? Please write in the chat. Why maxilla is called the beauty bone? This bone, maxilla, plays a crucial role in really. Middle of the face, center of the face. Yes, I see somebody did fibroblast, plasma, yes. Hold the structure, center of the face. Okay. Okay, and right now you can see in the image where the maxilla is located. If you don't know what is it, maxilla is a bone, is a one of skull bones, and maxilla located, you can see in the image. I recommend touching in it. I recommend it gently touch with clean hand. Yes, it's like upper jaw and upper teeth. Yes, and as you can see in the image on the right, A well-developed maxilla creates a more attractive facial appearance. Are you agree with me? Can you see that developed maxilla, like if maxilla moving forward, it creates more attractive facial appearance. Let's explore. Let's explore this in more detail. Okay. Okay. Take a look at these people. You'll notice they all have a well-developed maxilla, and our brain automatically perceives that as attractive facial proportions. Do you agree with me or no? Tap please yes or no. Let me know in the chat. You can see that all of these people have well-developed maxilla, like maxilla which moved forward. Yes? Okay. And now we are going to test it. Okay? Are you ready to test it? Okay. Which face seems more beautiful? Look at these pictures. For you, which face seems more beautiful? Left side or right side? In these photos, pay close attention to the position of the maxilla. Also observe the chin. Bring your attention to the chin, the lower jaw, jawline contour, and the eyes. Where do you think the features look more balanced and aesthetically better? You can notice that the jawline, chin, and maxilla have become more defined, while the eyes appear deeper in right side, like on the right picture. Yes? Yes. For you, for many face right side seems more beautiful, real, and it depends on maxilla. Okay, in this photo you can see that on the left the skull is in a more compressed position, and really, yes, I am expert and I see it. Like skull is more compressed on the left side. On the right side, after the work has been done, the cheekbones become more prominent, the jawline becomes more defined, the temples lift, the eyes up more, and if you like, even the gaze changed. If you look, like gaze, also eyes, appearance completely changed. And in this example, it's a man. Yes, here you see a guy who worked on his maxilla and skull. He brought his upper jaw forward, and along with it, the lower jaw and chin also moved forward. Yes, if you work with maxilla, lower jaw and chin also moved forward. This added volume to the cheekbones, and jawline became more prominent, and face became more masculine for men, and looked appearance. Okay, and yes, and when you work with your maxilla, lower jaw also moving forward, and your chin also moving forward, and jawline getting more prominent. Yes, it's a biomechanic. And everything depends on maxilla. Depends on the maxilla. Okay. Next, let's move on the next topic, the consequences of skull changes as we age. Okay, and let's take a look at how the skull changes with age. Yes, I'll show you a video, and you can see how skull changes with age. It's very interesting. Just a moment, please. Okay, my friends. Yes, it's a real video. It's not AI. And what did you see? Please text on the chat. Okay, interesting. The great knowledge. Okay, sagging. Okay, these people are young. You can. Okay, I saw the compression, skin dropping. Head looks more round, compression, contraction, maxilla shrunk, maxilla is getting down, the bones change with when aging. Modification of posture, yes. Forehead changes, bone is moving, yes. Bone changes, sagging, yes. Yes. Losing bone also. Yes, you could notice that with age neck is getting shorter, head is getting more like rounded. Okay, and of course we can see like drooping, sagging, everything. Yes, wrinkles also. Yes, but for me it's important that posture and skull was changed, were changed. Okay, yes, I agree with you. Okay, next. Unfortunately, after menopause, bone density and volume decreases due to hormonal changes. Yes, it's true. But I can also tell you that volume is lost not only because of hormones, but also due to misalignment of the bones, tension in the skull, a shortened neck also, and poor posture. Yes, everything affects our skull. Yes, and also density and shape of the skull. And this is something you can actually influence with your own hands. Yes, you can work with it. Yes, that's because as a result, the face loses volume and the soft tissues age faster. This is because the skin, subcutaneous tissues, and muscle are all attached to the bone of the skull, and they depend on the position of those bones. And it can appear like nasolabial folds become more prominent, pronounced, yes. Nasal lacrimal furrows appear. The face loses defined lines. The cheeks sag. In some cases, asymmetry appears. And in fact, facial asymmetry is a matter of biomechanics. If you open textbooks on cranial osteopathy, you'll see that this was described over 15 years ago. And so when you look at the face, at the ears, like in this photo, like ears, eyes, eyebrows, and jawline, all those asymmetries are linked to change in the position of cranial bones. And you can look right picture, and depends on positioning, like occipital sphenoid bones, they create different asymmetry. Asymmetry, eyes asymmetry, eyebrows asymmetry, ear asymmetry, jawline asymmetry. Are you agree with me? Could you see it? Please text me. And by working with the bones of the skull, we can completely correct the asymmetry also. It's really possible. And I'll show you some examples. Okay? It's really biomechanics. Many different cranial dysfunctions have been described that can lead to various forms of asymmetry. And this is science, and this is real science. It's not something I've made up. It's not. I've not made up it. It's science, and you can find many researches about it. Yes. That's why my entire course is based on scientific evidence. And here in these pictures, you can see that the position of sphenoid bone and occipital bone and the maxilla directly affects how the face will appear. Yes, occipital bones is this bone here. Sphenoid bones, it's this yellow bone. And maxilla here. And depends on how position in which position this bone, it affects to our appearance. Okay. And notice that the position of the upper jaw maxilla directly influences the nose and the shape of the eyes. And you can see it in these pictures, left and right pictures. Yes. Pay your attention to the nose and eyes. When the maxilla is positioned too far back, it can result in bulging, cow-like eyes and a nose that appears flattened with a visible hump. Can you see that eyes are different in these examples? And nose. It depends on maxilla also. Yes. Okay. Next. Okay. Here is clear clear example of what I mean. Yes, cow-like eyes tend to look more startled and less attractive. But when the upper jaw is positioned more forward, the eyes appear deeper set, and that gives the face a more harmonious and looks good. Can you see it? Are you agree with me? Which appearance looks better? Left side or right side? Agree, yes? Okay, nice. Okay, sunken chin appears. Yes, sunken chin is one of the main signs of underdeveloped maxilla. That's because when the maxilla doesn't develop properly, the lower jaw also tends to remain underdeveloped. Yes. Before, yes, I shown a picture. If maxilla is well developed, lower jaw also is well developed. Everything is interconnection between each other. Okay, and one example, yes, a sunken chin looks tilt inwards, whereas an extended chin looks outwards and is perceived as a sign of youth and health. Yes, you can see in this picture. Okay, and please pay attention to how your children's faces are developing. It's really very important. And it is much easier to correct the maxilla during childhood. And many osteopaths often say that what can be corrected in a single day during childhood might take 10 years to fix in adulthood. In real, yes, it's real, yes. In childhood, everything correct easier than in adulthood. Because, and if your child has some problem, yes, I recommend work with this and study how you can improve it. Okay, now we're gonna do test. Check yourself, okay? Are you ready? Okay, are you ready? What we will do? Please close your eyes and relax. And feel where your tongue lies. Your tongue, yes? Where your tongue is lying. This simple test can reveal how well your maxilla has developed. Really, because tongue is a very important thing. Yes, and now open your eyes and you could write in the chat. We have 3 options. And at first, yes, I would like to explain. The palate is located inside the mouth, just behind the upper jaw and behind the upper teeth. Okay, and 3 choices. First, the whole tongue is firmly pressed against the palate. Second, only the tip is pressed against the palate. Third, the tongue is lying down, not pressed against the palate. Okay, write in the chat, please. Write down, please. And for us, very important know where our tongue is lying. Okay, 1, 1, 2, 3, 1. Okay, okay. 3, 3. Okay. Okay. Who tap first? It's a good. It's a excellent. Yes, it's a normal position. It's a normal position. Second, it's okay, but you can improve it. Third, it's not okay. It's a real problem and you should work with it. If your tongue not pressed against the palate, it's a bad sign. and it affects to your appearance and your health also. Okay, I believe this will be new information for many of you. The position of your tongue plays a crucial role in how your face develops. You might not notice any changes in the moment, but over months and years, if your tongue is in the wrong position, it can negatively affect both the body, it can negatively affect the both your appearance, your beauty, and your health also. And you can see in these pictures, left pictures, it's wrong position, and the right picture, it's a good position. It's normal position. And here the place where the tip of the tongue should normally rest. Yes, in this illustration, it shows where the tip of the tongue should rest in its normal position. The tip should lightly, and in normal, yes, if your health, the tip should lightly touch the area just behind the upper front teeth. Yes, here, lightly touch. And the root of the tongue, like deeper, should press gently against the palate. It's a good position. And tongue will be push palate and lift up palate every time and change maxilla. Okay, and please write yes or no in the chat. Do you have pronounced nasolabial folds? Do you notice nasal lacrimal furrows under the eyes? Does your chin appears to be pushed back? Does the distance between from your nose to your upper lip seems too great? Do you have crowding of the teeth or bruxism? Please write in the chat yes or no. Do you have this problem or no? Each yes is a signal that you need to work on the maxilla. Okay, yes, I see. Yes, yes, yes. Yes, many tap yes. Okay. Next. How is it even possible to change skull bones? Okay. Did you know that the bones of the skull are mobile and flexible? Yes or no? Did you know about it? Our skull is not a monolith. It consists of 29 bones connected by sutures that remains mobile even in adults. You can find a lot of studies on this topic. Yes, a lot of studies research this. Our skull is not a monolith, and we can work with it, with these bones. These bones move microscopically, and in many cases, that's enough to change your appearance. I tell you, in newborns, the bone of the skull are very mobile. This flexibility helps the baby pass through the birth canal. As we age, the skull bones, the skull becomes more rigid, but a certain degree of mobility and bone plasticity remains even into old age. Because of this, the skull continues to change shape over time, which leads to an older appearance. Yes. However, we can also restore useful facial proportion by using specific techniques that work with this remain flexibility. Yes, and you can work with it. Bow movement can be stimulated by releasing tension from muscles, fascia, and bones. Bones return to their physiological position by osteopathic techniques. Yes, I'll teach people how you can work with your skull, with your bones, using gentle and safe techniques. Also, gently working with the upper palate and tongue and establishing proper swallowing, chewing, and breathing functions. We use mewing techniques. Write in the chat if you know what is mewing. Okay, I see many of you don't know what is mewing. Okay, the changes are not instant. Okay, and of course, the changes are not instantaneous, but very profound. And most importantly, they last for a long time. Because we work with very foundation, not just on the surface. And I'll show you students' results. First, in this picture you can see the contour of the chin and jaw have become sharper. It's real cases. It's real cases, my students. Second, in the lower part of the face has disappeared. The cheekbones have become more pronounced, visually tightening the face and making it look younger. Can you see it? Can you see difference between left picture and right pictures? Can you see how the maxilla is changed? Chin is changed. Jawline appeared. Yes, nice. Okay, next case. In this case, you can see the chin has moved forward. The contour of the lower jaw have become more defined. The whole face looks younger, more composed and symmetrical. Could you see it? Please tap on the chat. Write in the chat. Okay, and this it's one of my one of good results in our academy. The face has become more symmetrical and composed. Cheekbones are visually lifted and more open look. Yes, in this case you can see how face changed, how asymmetry is changed, and face became more symmetrical and harmonical. Yes, and this changing and not only face changed, body also changed. The back has become straighter and the shoulders are pulled back. The neck looks longer and more sculpted. The jawline is more defined and the double chin is reduced. And you could see that it's like woman with age, yes? Age woman. And even if you start do these techniques like in 50 years, in 60 years, you can change your appearance. Any ages, okay? In any ages. And your appearance and also postures also will change. Because everything are in interconnection. And I promised to tell you about my new course, Maxilla, the one I personally believe is the best and most effective of all my programs. And it's called Maxilla course. Maxilla, and it's a really powerful program. And this course triggers deep transformation, not superficial layer. It's a really deep work with deep transformation. Shape a more harmonious face and slow down aging. After in 5 minutes we will do a few exercises. I'll show you a few exercises, but first I'll tell you a bit more about my course, Maxilla course. Okay. What's included? This course includes 14 days of guided practice. Every day we will send you video lessons, and it takes just 15-20 minutes a day, and I'll give you 2 years of full access to all my materials. 2 years, you can do it 2 years. Okay. And what you'll get after first week? After first week, you'll notice less tension in your body, in your posture, in your scalp. Your posture will begin to improve. Your neck will start to lengthen and getting longer, and your face also getting more like elongated. After the second week, you'll see visible change in your face. A lifting effect will appear. Nasolabial folds and nasolacrimal furrows will become less noticeable. Okay? And after a few months of practice, friends might start asking, have you had plastic surgery? It's really true. If you start do these techniques, your appearance will completely change. It's really true. It's possible, and people can say even, have you had plastic surgery? Your appearance will shift in a truly noticeable way. How will your face change? The bone of skull will take an anatomically correct position, and you will get defined cheekbones and attractive facial contours, reduction of nasolabial folds and nasolacrimal furrows, natural lifting without injections, symmetrical and harmonious facial features, a well-kept and rejuvenated appearance for 5-10 years, and beautiful smile. Okay? And you will receive a certificate for completing the self-correction course after completing the lessons. Yes, I'll give you a certificate. And yes, it was a new release, my handy app for iPhone users. And even if you don't have iPhone, you'll get access to user-friendly platform, my platform. It's really in my platform you can see you can look all my materials, and also in the app, so you can learn anytime and anywhere. Okay, and what about price? Launch price. This is a new course, really a new course. I presented this course first time, and I give you like special launch price now. You can get the standard plan with video lessons for only $179. Just $179, yes? But please hurry, because it's less than 6 months access Faceplasty Club. And I'll give you everything this 6 months in my Faceplasty Club with many my courses and other courses and Maxilla course. Just today, just 24 hours, within 24 hours now, okay? Buy this course within 24 hours and get it. 6 months free in faceplasty club. And if you doubt about anything, no doubt, because you risk nothing. You've got nothing to lose. We offer 100% money back guarantee. Try the course, and if it's not for you, we will refund you money without any issue, real. And I think you should try. You should try, and even if you don't like this course, we return money. I think it's a really good offer, because it's my first webinar, and I'll give you best offer, whatever yes I did before. Are you interested? Please say yes or no in the chat, please. Is it interesting for you, this offer? Interested. Okay. Yes, and just compare $179 and how much people spend money for cosmetologists, plastic surgeons. Yes, of course, you'll get results, like superficial results, if you go to cosmetologist or plastic surgeon, but it is more dangerous way and more expensive way in real. And these ways like cosmetology, plastic surgery will not give you a health also. It just will take you some like visible change, but not it's not profound, it's not deep work. And if you go to cosmetology, I think you can spend more than $1,000 for like some procedures. Yes. If you go to plastic surgeon, I think you'll spend more than $10,000. Are you agree with me or no? And Maxilla course is just $179 with 6 free access to my faceplasty club, and you can study 6 months with my top trainers in my academy. And it will be natural results, one-time investment, no needless. Okay. How to leave a request? To submit your application, go to the website via the link in this chat. Yes, you can see the link now. Yes, my assistant shares the link. Yes, you can see now. If you would like to submit like best offer now in this day, go to the website via the link in the chat, and in the website click the button. You can see the button and enter your mail and payment details. Okay. And we can like wait 1-2 minutes, and you can do it, like just like follow the link and just click the button and enter your mail and payment details. Let's open this link and save this link. Save this link because it's the best offer for you now. And I'm glad to see you in my faceplasty club, in my online platform. Yes, now course just in English, but in the future we'll translate this course in other languages also. Yes, save the link. Okay. Okay, this link I think we show you maybe a little bit later also, but do it. Okay, and now we're going to practice. Yes, and please, you show like prepare your hand. Okay, now for this practice is very important. What we will do now? Yes, I'll recommend wash your hands now, because we will work also not only outer but inside and the mouth. Okay, and I recommend you to wash your hand. Okay, and we take a little bit break, like 1 minute. Okay. Okay, are you ready? The link is not opening. We can ask you all the time if we pay. At what language is this course? Please share the link on WhatsApp group. Yes, I think my team shared with you the link, yes? In what language is in this course? This course in English. Okay, are you ready? Yes. Okay, okay, and we're gonna to start practice. Okay, nice. Okay, so I would like to show you a result, and that's the reason why I recommend work with one side. Yes, we can like divide our face like left side and right side. Yes, and we are going to work with one of the sides. Okay, and after we will work with another side, because I would like that you see noticeable result. Okay, just for few techniques. Okay, and first, please look at your face, look at the face, and compare your eyes, eyebrows, ears, cheekbones, jaw lines, like left and side, and which side for you looks better, and which side for you looks worse. Okay, check it, find it, and you can start with side which seems looks like more like little bit less better than other. Okay, okay, left better. Okay, 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 okay. Choose with which side you will start work. Okay, okay, you can start with right side, with left side, it doesn't matter. Okay, okay, I'll start with like which side with okay, okay, I'll start with like left side maybe, or right side, doesn't matter. Okay, so we're going to begin by working on the neck. it's a base of of the skull, neck, because when the neck is shortened, it negatively affects the face. We'll start with the trapezius muscle. It's a very important muscle, since when it tenses, the neck shortens and the shoulder rise. Yes, if this muscle tense, shoulder rise, and neck getting shorter. Okay. What we should do? Okay. With one hand, grab the trapezius muscle on back side of your neck, like here, like yes. If you raise your shoulder, your trapezius muscle is contracted, okay? And you should grab the trapezius muscle here, this one, you can see, like this. Just grab and hold this muscle, like with your palm, okay? With your finger and palm, okay? Hold this muscle, hold, without squeezing, just hold this muscle, okay? Another hand, you place back of your head, like where is located occiput, okay? And we're going to work with one side, okay? Just hold this trapezius muscle here, because this muscle attach to occipital bone. This muscle attach occipital bone and spine and yes, other bone, shoulder. Okay. Okay, and hold like occipital bone, like this. Yes. And now what you should do? You should tilt your head opposite side and pay attention, bring attention in this area and feel how this muscle is stretching. And you should stretch this muscle and just relax. And after a moment, you'll notice that the side you worked on feels more relaxed and freer. After when you finished it, just allow yourself to feel the stretch and relax and okay. And you just relax, like hold this muscle and hold the occipital bone and tilt head opposite side. Tilt your head to the opposite side and feel the stretching. And we do it like 1 minute. Like close your eyes, just close your eyes and relax and feel how this muscle is stretching. And deep in, breathe in, deep, and breathe out. And feel how this muscle is stretching. Please hold this muscle. Please hold, grasp this muscle and stretch this. Okay, one side. Okay, we do it. And next, we can also use like gliding movements along the front of the neck to help relax the platysma muscle. Yes, it's also very important muscle, platysma muscle. We can do gliding movements like this. Gently place your fingers in the front of your neck, like your palm and fingers, and make slow strokes, like gliding strokes. Yes, strokes. Like just go from downwards, okay? From your ear, like do it. and little bit uh, tilt your head opposite side and do it like this. Do it 1 minute. Okay, enough. Okay, and what do you feel now after this? It helps. These techniques helps release tension, improves lymphatic flow because a lot of lymphatic nodes are located here, and vessels also, and it supports a more lifted, useful appearance. Yes, relaxed, good. Yes, and this area, yes, more like becoming more relaxed and freer. Yes, and look, okay, we're going to next. We're gonna start next exercise, and after we'll check. Okay, next exercise: jaw muscle activation. Just repeat the movements after me. Okay. Uh, it's like chewing muscle. It's very important muscle. Chewing muscle. It's like there are few chewing muscles. It's like temporal muscle, like chewing muscle. It's like masseter muscle, and also pterygoid muscles, like lateral and medial. And we're gonna to work with masseter now, and this muscle often tense and contributes to an older looking face in real, yes, because it's very powerful muscle, very strong muscle, and these muscles accumulate is this muscle accumulating a lot of stress, and okay, start work with this. Okay, with one hand gently grab this muscle from the outside of your cheek. Yes, just you could bite and feel how this muscle work. Okay, and just just apply, like just hold, like place your finger outside of your cheek and in ways muscle located. Okay, here near jaw angle. Okay, this muscle work. Okay, fix this. Another hand, with your clean hand, or you can use like this gloves if you want, or with clean hand, reach inside your mouth and grasp the muscle from the inside, and we should hold this muscle inside both sides, outside and inside. Okay, and once you have the muscle held from both sides, we start doing gentle massage movements to release the tension. And after, when we will release the tension, we start soften, stretch these muscles, the muscle downwards, slowly and carefully. Okay, let's do it. Okay. Okay. You put inside like thumb. Okay, and hold this muscle inside and outside, and just like do massage movement. Okay, I think it's easy. You just you need just hold this muscle inside and outside, and do some like simple circular massage movements, just like, and this muscle getting more relaxed and relaxed. Okay, and after when you felt that this muscle became more relaxed, we continue with stretch this muscle downwards. Okay. Now we hold this muscle outside and inside, and pull this muscle downward. Okay, downward. Pull this muscle downward, slowly and carefully, and uh, and just relax. Breathe in, breathe out, like in like meditative condition. You can close eyes and feel how this muscle is stretching. Okay, will stretching. Okay, you fix this muscle and downward. And I would like to say that it saves for your it is safe for your skin, because when you pull downward your muscle, your skin is not affected. You can check when I hold the muscle and pull it down, your skin is not affected. Gosh, you can see that my skin is moving. It's like good sign. Okay, and what do you feel now? How do you feel now? Okay, and smile, and what do you feel in this area? And next exercise, we will okay, and next we're going to lift the cheekbones, like cheekbones. This is cheekbones here. Can you see? This is cheekbones, and we can lift these cheekbones. And now we're going to lift the cheekbones. To do this, how we can do it? You should place your palm directly under your cheekbones, like cheekbones, and I should like place palm under cheekbones, like here. Yes, can you see? Okay, you place your palm directly under your cheekbones, and now gently press your head downward in your palm. Okay, using the weight of your head, not force, without force. Just place your elbow on the table. Press and place your palm directly under your cheekbones, and using weight of your head, just like press your head downward in your palm and relax without any force. Just relax and and you could allow the pressure to transfer naturally. And as you hold this position, you'll begin to feel the cheekbone gradually lifting upward. Okay, it's subtle motion, but just relax, close your eyes, and feel it. How the cheekbones, when you're relaxing, the cheekbones lift up, upward. Okay, and just breathe in, breathe out, and feel it. How the cheekbone is lifting upward. Just relax. Press your head downward in your palm, using the weight of your head without forcing. And feel how cheekbone is lifting up. And we will do it. We do it 1-2 minutes. And relax. I would like to show you how it works. It works. And that we can influence to our bones, skull bones. Even use simple techniques. But in my course, I'll give you like more like deep and profound technique. Okay. And now we can compare like your right side and left side. Okay. And what do you feel now? Close your eyes and check your condition. Check your body condition, check your facial condition. Like your parents, like just condition, like your physical condition. Could you say that that side, like your right side or left side, getting better or became better, like more free? Your like skin like became more tightening. Yes, amazing. Relax and feel lighter. Great. Relax. Okay, and now I recommend like put place your hand place your finger under cheekbones and look it. Yes, I work with this cheekbones, and these cheekbones getting like lift up. Can you see? Like these cheekbones, my cheekbone lifted up, and my ear also little bit lifted up. My eyes, my eyebrow, like this side lifted up. And check your face, please. Amazing. Okay, amazing. Wow. Looks slimmer and relaxed. Yes. And we did it just 3 techniques, simple techniques. Yes, cheekbone is lifted. Yes, it works. Super. And it's a simple techniques. And I wanted to show how it works. And just imagine if you do all my techniques in my Maxilla course, it will completely change your appearance. Really, it's really work. It really works. Yes, okay. Okay, we're going to do like another side, like little bit for balance. Okay. Okay. Okay, go and start again with neck release. You know, like hold this like trapezius muscle, like rasp and hold. Other hand place on your occipital bone and tilt head opposite side and stretch. Like feel how trapezius muscle is stretching and close your eyes and relax. Just breathe in, breathe out and feel it how muscle is relaxing. Slowly, slowly, slowly. Bring your attention in this area, in this muscle, and relax and feel how this muscle is stretching. Okay, little bit do it. Okay, now we're going to work with also with platysma and with like strokes, just from your ear downward, like doing strokes, and tilt your head opposite side also. And this movements stretching your platysma muscle and relaxing your superficial fascia, neck fascia. Okay? Okay, nice. Now, we're gonna to work also with your chewing muscle, with your masseter. I recommend wash your hand. I use glove. Okay, and we do like same. Like you place your finger and hold outside the masseter. Masseter is located where like jaw angle. Yes, and with your finger go inside and hold this muscle inside both sides. Okay, and we'll do massage. Okay. Okay. After circular massage movements, we stretch this muscle downward. Okay. Okay. Hold this muscle both sides and pull down. Okay. Okay. How do you feel? Okay, and next we're gonna to work with cheekbones. Okay, place your elbow on the table. Okay, place your cheekbone like on the palm. Okay, and press your head downward into your palm. Okay, palm. Using the weight of your head without force. Just like press your head downward using the weight of your head. Okay, and just relax. And feel how cheekbone gradually is lifting upward, up. Just relax and feel it. bring your attention to the cheekbone. Okay, breathe in, breathe out, and relax. Okay? And how do you feel now? How do you feel when you worked with both sides? Okay? Please write on the chat. Great, 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 great. Nice. Okay. Nice. Nice. Perfect. Yes, amazing. Yes, okay, amazing. Super good. Feels good. Okay. Yes. I see you got it. Okay, thank you. Okay. Okay, we continue. We will continue. Okay, revitalizing effect. Okay, working with the skull bones is not just about beauty. In real, it's not just about beauty. It's about the health of the whole body. And yes, I work with patients, and I'm using these techniques not only for beauty, also for health. And what you'll get first, restore proper breathing and stop snoring. It's really possible. The maxilla forms the nasal passage. The maxilla forms the nasal passage and affects breathing. When the bone is displaced, breathing is impaired, especially at night. The result: snoring, chronic fatigue, anxiety, and headaches. And you could remember that I asked you when we start this webinar, and if you feel low energy, it can help, because when you restore proper breathing, yes, and your fatigue will disappear. Okay, the result. Okay, when the maxilla is corrected, nasal breathing and sleep are restored. And write plus if you have noticed that you breathe through your mouth. Okay. If you notice that you breathe from the mouth through your mouth, please write plus. Okay, it's for you. Second, improve digestion. The tongue is the most important bridge between the skull and the body. Dislocation of the maxilla means the tongue falls downwards. This causes tension in the neck, difficulty in swallowing, worsens the work of the GIT. When the bone is corrected, the tongue is lifted, swallowing and digestion are restored. Yes, write plus if you have a problem with this. Next, reduce anxiety. Okay, tension in the skull affects emotion and the psyche. Okay, next, get rid of headaches and improve vision. It's also possible to improve vision. It's really true. No more slouching. The maxilla affects the position of the whole body: maxilla, nape, neck, diaphragm, and pelvis. Everything are interconnected. Okay, bone displacement leads to slouching, neck strain, and pelvis misalignment. It's everything interconnection. By correcting the maxilla, we harmonize the posture and position of the whole body. Okay, write plus please if you have this problem. Okay, next, straighten crowded teeth and correct the bite. Yes, if you have a problem with the bite, this course will help you. Okay. The position of the maxilla is directly related to the teeth and jaw. Yes, I said it. And when the bone is displaced, the teeth lack space, resulting in crowding and misaligned bite. You can see like wide bite, it's a good, like wide maxilla, U-shaped maxilla. If you have V-shaped maxilla, it's not okay, and you can have a problem. You can have a problem with your bite. You could have, and this causes jaw overload, enamel eraser, migraines. Through osteopathic correction, we create more space for the teeth. Natural align the bite. You can see in the photo how the space for the teeth has increased by a few millimeters, and it's real. It's really true. If you read some articles about mewing, about osteopathic treatment, it's true. You can change your bite and make like more wider your bite. And after my course, many participants noticed that their bite was changed and became more wider. It's really true. It works. Yes, and it's a real result in my academy, from 23 millimeters to 27 millimeters. After this course, Maxilla course, it's a real result from my course, Maxilla course, and you'll do it in you can do it in this course. And the jaw is extended. Yes, I told you about jaw. Yes, is extended. It is especially important to do this before or during orthodontic treatment. If you're doing now orthodontic treatment, it's very important to do this exercise, because it can speed up your work with your orthodontist also. 7. Correct facial asymmetry. Yes, I told you about it. And now I'm gonna to tell you history of transformation. And we have prepared one more surprise for you. Okay? Are you ready? Are you interested? Where are you? Please write. Yes, ready. Okay. Yes, okay, nice. Okay, let me introduce you to Victoria Romanova. We first met when she was a student in my academy, and now she is one of our instructors. Over the years, she transformed in incredible ways, and Vika, share your story with us. Okay, I'll connect Vika. Okay, 1 second, please. Sorry. Okay. Okay, where is Vika? Where is Vika? Sorry, just a second. Vika. Yes, Vika. Hello. Hello. Can you hear me? Just a second, please. 1 second. Please switch on your mic. Sorry, just a sec. Some technical issue.
Hello, Alice. Do you hear me?
Yes, I hear you. Yes.
Hello,
Okay.
hello.
Hello, Alice. Do you hear me? Yes, I hear you. Yes.
Sorry.
Perfect.
1 second. Okay. Yes, just a second. Sorry. Yes, we have some problem. I have to use ear maybe because echo. 1 second. Just a second. Could you switch off your mic now? Just a second, please. Could you switch off your mic? Okay, one technical problem.
Now you hear me, guys?
No, it's okay. Just a second, please. Sorry. We have some technical issue. Just a second, please. Sorry. Just a second, please. Okay, because we have echo, and I should use like ear pods. I think it helps. Just a second.
Okay, guys, tell me please if you hear me or no, because
Can you hear?
I don't understand.
Can you hear me now? Vika. Vika, can you hear me now?
I think wait a second.
Just a second.
I think I hear something.
Just a second,
Guys, can you
please.
please turn on the microphone? In Zoom.
Okay. Okay, can you hear me now? Can you hear me now?
I think I hear something, but not a lot. Wait a second. Yes, sorry guys for these technical problems. Do you hear me, Alice?
Yes, I hear you. Yes. Uh,
Yeah, I hear you now.
yes, I hear you. Okay, nice. Okay.
Perfect. Finally.
Yes, we should like use like air. Okay, AirPods, like AirPods. Okay. Now it's okay. Okay.
Yeah.
Nice, nice. Okay.
Yeah, perfect.
Nice. Okay. Just a second. What is problem? Just a sec. Oh. Yes. Okay. Okay. Vika, how did you discover faceplasty? Tell about it.
Oh, it was a really great way, you know, guys. So, first of all, hello everyone. You know, I started noticing that something in my appearance was changing, and not in a good way. But I couldn't figure out, you know, exactly what. If you have the same problem, you can comment plus, text plus in our chats. So I didn't understand. I look at in the mirror and I say, I can't understand, but something is different, you know, something changed, and not in a good way. And so now I understand that it was my maxilla, it was my upper jaw, and it started to shrink and change its angle. So I also have, by the way, skull. If you see that this yellow bone is the maxilla, and it started to change in my face. So now I understand this, but previously I didn't understand this. Back then I had no idea what's going on, and I just felt I needed, you know, to do something before it got worse. So I've always believed, you know, prevention is better than fixing things later. So guys, I started with what was popular and known. Yes, it was face fitness. So I started to do face fitness with my face. But after 3 months, I noticed nasolabial folds were actually getting deeper from these exercises. And I didn't understand why. Um, Now I understand, because I had the hypertonus of my face, and that's why with these exercises, these nasolabial folds start to be deeper and deeper, look deeper and deeper, and that's why when I started looking for a better solution, yeah, and found faceplasty. I went to study to Alès, to Dr. Alès. I studied, he was my, of course, trainer and coach and doctor who tell us what to do. And it changed everything. I swear to you, it changed everything. I switched, first of all, my career. And I become even more beautiful naturally. Yeah, so it was really a life-changing process. Yeah.
Yes, Vika, it's really true because I met you maybe 7 years ago, maybe yes,
Yeah,
7 8 years
7
ago,
years ago.
and you finished my education maybe 2017, yes,
Yeah,
2017.
2017. It's like
Yes,
7 or 8 years ago.
yes, I surprised you completely changed your
Yeah,
appearance.
you see that my
Yes,
bones
and
start to change.
okay, and
Amazing.
what has changed in your appearance since then? What can you describe everything? Now I'll show your before after, yes, and could you explain for our audience One
Yeah, for
second.
our guys, of course, I will
Okay.
explain because it's a lot of things to do, a lot of things changed. Yeah,
Okay.
let's see my photos
Okay.
before and
Yes.
after.
Yes. Okay. Photo before left. Left photo, and left side.
Yeah,
Yes.
yeah.
And
So
but now I think you looks better than right photo also. You
thank
look
you, Alice.
better.
Yeah,
Yes.
yeah. Through months, through years, all our trainers, also me, we train face plasty. We work with our maxilla, with our bones all the time, and we see that all our trainers, including me, we change, but in better ways. So through the time, yeah. Thank you, Alice, so much.
Okay.
And
Okay.
yeah, I will explain now. So first of all, look at the left side. Yeah, so it's before. It's like 7 years before, and look at the shape of my face. Look at inside of the bones, not just in the skin. Yeah, because I'm more or less like I'm young. Yeah, but you can see the skull. You can see foundation, and you can see how it how it uh, how it changes through the time. So first of all, the nasolabial fold that we hate, all women hate, yeah, you can agree, girls, yeah, you can agree that we really hate this nasolabial fold, yeah, they went away completely. So on the left side, it started, yeah, you see that it's like it started, and on the right side, if you again, Alice, if you return, yeah, a photo, you can see that it completely went away. Now you also can see on my face on video that I don't have any more nasolabial folds. So second, the wall geometry of my face changed. So you can see the outer corners of my eyes lifted. Yeah, you can see on the left side, on the right side, the corner of my eyes lifted a bit. Yeah, making my eyes more almond shaped. My cheekbones, my temporal bones opened up, and the face became more, like projected and wider, so more horizontally developed. And I truly believe I became really more like handsome, more beautiful. And that's all from working with the bone of the beauty, with the maxilla. Because we're not just working with muscles, we're working with actual structure and architecture of the face. So that's why you can see that our architecture and geometry of my face was changed. So this is truly very deep uh, differences, yeah, changes. Yeah. So this is what I can explain, what I can
Okay, thank you
see
so
on my
much. I think
face.
it's very useful, and I know that many people uh, think that maybe you got a surgery or some injections, and I would like to ask you: have you ever had plastic surgery?
Yeah, this is very common question that people always ask me, and this is okay. This is totally okay. I'm fine with this, and I will tell you completely, of course, the truth. So for years, guys, yes, I can tell you very, very honestly, yes. For years, I used to get fillers, lip fillers, yes, lip fillers, and also Botox inside of my forehead, yeah, before I learned about faceplasty. So yes, you can still even see more fillers, some fillers, yeah, in my lips. But I stopped getting injections a long time ago, so like 6 years ago. Yeah, so I did like lips for like 7 maybe years, like 1 milliliters per year. I did, and I did a Botox because I hated my wrinkles on my face. But then when I discovered faceplasty, I understand that I can do everything with my hands. I can relax my head. I can relax my head bone of the bone, yeah, the forehead. I can relax all skulls. I can work with my body, with my diaphragm, and I can get rid of wrinkles completely. Of course, I can't change my lips, yeah, but it is what it is. So my view has changed, and I now believe in supporting the face naturally, you know. But this was a part of my path, and I had to go through it to get where I am now. Yeah.
Okay,
So it is.
thank you. It's
Yeah.
incredible, and I know that your life completely changed. And how did your friends and family react to your transformation? Because it's also
Uh,
effect to your life. It affects your
Yeah,
life.
okay, yeah. Thanks for your question. You know, I will tell you the truth, honestly, the changes didn't happen, you know, overnight like this, like one night and I completely different. No, no, guys, it doesn't happen like this. We need to understand that this is a process, yeah, and it takes from like 3 6 months to a few years even. So this is the differences that you see, like 7 years before and after my photo. It's 7 years, yeah. But I can tell that like 3 4 6 months, yeah, and you will start to see the difference, like real
Mm-hmm.
differences.
Yes.
Yeah. So yeah. And we need to understand that our face and body need time to rebuild. Yeah. So at first I didn't notice big changes in the mirror, but when I compared old photos, like from 3 years ago, 1 year ago, the difference was obvious, really obvious. And
Yes.
now people give me more compliments. Friends who haven't seen me for a while, ask me like, "What did you do, Victoria? What did you do? What did you do? You look so good. You look amazing." And I just smile because it's all thanks to slow, steady work with the maxilla. Yeah.
Yes.
So
And
yeah,
the
like
real
this.
results is accumulating.
Yeah,
Yes.
prolong.
Yes.
Yeah.
If you do it like step by step, yes, you're getting better and better, definitely. Okay, and I see some questions for you, like easy questions. Okay, someone asked, how old are you?
I'm 36, guys. I'm 36. Soon in autumn I will be 37.
Mm, okay, nice. Okay, and someone asked, um, can I expect a change in nasolabial folds and saggy neck at age 70? Is it possible to do something in 70 or 63? Is it works also at old age
Yeah,
at
sure,
63?
guys. Of course,
Yes.
you understand that. I suppose, Alice, you already tell to our clients, yeah, that maxilla, we change the angle of the maxilla, yes. So all these tissues start to be more smoothly, yes, and the nasolabial folds. You can effect on it, yeah, yeah. In
Yes.
I think in
Okay.
how do you think, Alice? I think in all
Of course,
ages, yeah.
I think in any ages, and
Any ages.
if you start early, like in 20, 25,
Is it better?
it's yes, it's a better, because you should know how can you improve yourself, your appearance, your beauty, how you can work with your body, with your posture. I think it's a very important thing. I think this topic should people should study from childhood in real. Yes. Okay.
Yeah, totally agree.
Thank you, Victoria. Thank you so
Yeah,
much. Yes.
thank you
And
very much, Alice. Thank you,
Victoria
guys.
is an instructor in our like academy. And if you come to our beautiful faceplasty club, you Victoria teach you many things. Yes.
Yeah, thanks, guys. Thank
Okay,
you.
thank you. Thank you. Thank
Thank
you
you.
so much. Yes. Okay, my friends. Okay, we closer to the end. Yes. Just a second, please. Okay. Uh, okay. Next, we close to end. Okay. Uh, let me remind about your bonus. It's 6 months of access to faceplasty Lab, our exclusive membership community, and you can learn this exercise with Victoria also, and with other perfect instructors and very perfect and experienced instructors in our community and our faceplasty Lab. And you can find link in the chat. Yes, yes. Did you find the link in the chat? And yes, now I will answer the most popular questions. Yes, and first, it's too late for me to start. I should have started earlier. No, it's not. It's not true. My students at 40, 50, and even 60 years old, and are getting noticeable improvements. Yes, I talked with Victoria about it. Yes, the skull bones retain the ability to change at any age, just at different rates. Right now is the best time to start. Anytime it's a best time for start. Okay, is it dangerous? Yes, maybe someone think it's dangerous. No, it's not true. Because now we did you did some exercise with me. It was dangerous? I think no, because I'm a doctor. Yes, I'm experienced doctor, and I've been practicing many years, more than 15 years. Yes, and I know which exercise are harmful, which is exercise are safe and healthy. And in my courses, all exercises are safe. It's not dangerous. And you can harm yourself because all the movements are physiological and only aim the natural relax and gently restore the bones and muscle at the face. Okay? Next. What if I don't succeed? This will only happen if you drop out of the class. That's why we offer 100% money back guarantee within 2 weeks. Okay, if you don't like it, okay, we return money, no issue. You risk nothing. Okay, next. Okay, those who will join the course, gifts as promised. Look in the chat. Video instruction on buccal massage. Okay, yes, I promised you, and I shared with you video instruction on buccal massage. Okay. Okay. Did you get it? Yes. Can you see? Yes. We shared with you a gift, and you'll get it. You can get it. Okay. Okay, friends. Okay, we finished our webinar, and if you have some questions to me, I can answer question for some question. Okay. Okay, first questions for you. Did you get something useful from this webinar? Tell me, please. Did you get something useful from this webinar? It was useful for you? Okay. Yes, yes, yes. Useful. Yes. Great. Yes, awesome. Okay, I answer for some questions. Okay. Uh, the results will be forever, or we have to do the exercise every day forever. I think second, yes, you will get great results if you start and do exercise at least few weeks. Yes, you'll get good results, but I think you should have a habit. Yes, and you should do some exercise. It's not hard. It's not hard. Just like 5, 10, 15 minutes, bring your attention to your face, to your posture, and it will be enough. If you do like 5, 10, 15 minutes every day, bring your attention to your skull, to your appearance, to your posture, it is okay. Yes, you can work with yourself more than 15 minutes. Sometimes I can work with me like with my body, with my skull, like even 2 hours. Yes, but it's not necessary for all. If you would like to have good results, you just you have to start and do something. Yes. Uh, okay. Okay. Which course helps with hump? Maxilla course helps with hump because hump appears because of bad posture and because of uh, skull dysfunctions also, and if and even our bite affect to our neck and hump. And I think it's a great if you start with Maxilla course in real because uh, I shared another courses, but that courses were like it was great courses, but little bit more superficial because just in this course I'll give you a very deep work with your skull bones. If you have injected hyaluronic acid, can you still do the exercises? Yes, you can do it because yes, you should avoid these zones where hyaluronic acid located. Yes, but you can work with your bones. You can work with skull bones. You should avoid some massage movements, like lymph drainage movements. Yes, in the area where hyaluronic acid located. Yes, but you can work with bones, and it's Maxilla course. It's a great course because you can work with bones even if you have hyaluronic acid, Botox. It's not problem. It's not problem. Okay, how to remove eye bag? Eye bag depends on depends on from skull bones also because poor blood circulation uh, creates creates eye bags, and if you work with your bad posture and skull, you could reduce these airbags, and uh, Maxilla course will help you also, and face plastic lab also, where we give a lot of useful techniques, a lot of useful classes. What about frown lines on forehead and turkey neck? What is it? Turkey neck? I don't know what you mean, turkey neck, but maybe it's like it's wrinkles, like horizontal wrinkles on the neck. Yes. Yes, if you work with your bad posture and if your neck is getting longer, and if you work with your skull bones, uh, like frown lines will be disappeared, and also I think turkey neck also disappeared, will disappear. If you have inject, okay. Belly pulse can fixed. Belly pulse can. It's a difficult topic. It's I recommend. I recommend go to like osteopathic doctor, and I think it depends on how much how long it was when it happened, bell palsy. If it happened recently, yes, it is possible to change. If it happened like 10 years ago, it will be difficult change it. Okay, so for bruxism and pelvis floor tension, you devise maxilla. Yes, advice. Yes, my advice. Yes, start with maxilla course and continue your work in my faceplasty club. Turkey neck, saggy neck. Okay, I understand. Yes, yes. Can exercises help with scoliosis? Scoliosis, it's a really difficult topic, and I will not give you a guarantee that scoliosis disappeared. No, it's a difficult topic. Yes, you could improve your posture. It's definitely, but fix scoliosis like completely. It's no. I will not you guarantee about it. Is the course live or can I do it anytime? Yes, you can do it anytime because we in my platform you will find many classes and many video lessons, recorded video lessons, but we have live classes also. Yes, with our like coaches. Exercise for sunken cheeks. Yes, Maxilla course works with it. Yes, go to Maxilla course and my faceplasty club. Okay. Okay, I wear retainer. Okay, I wear retainer every night during sleep. Will it affect the maxilla maintains good shape? Bad to me. Yes, retainer. Of course, retainer affects to your maxilla a lot. Yes. Will the help with asymmetric creasing under one eye when smiling? Yes, I think yes. What about belly fat? If you have belly fat, I recommend my another course. It's like women's course, and in that course we work with belly fat also, with belly. What about skin tightening to avoid the sag? What about the skin tightening? Okay, you should work with your skull bones. If you work with your skull bones, if you work with your chin muscles, with your mimic muscles, and with your blood circulation, with your neck, with posture, sac can disappear. Will disappear. How to prevent eye socket from going wards? Work with your skull also. It's also depends on it, or depends on from your skull. I have Botox now. Can I do this exercise? Yes. Even if you have Botox, yes, you can do this exercise. It's safe. I have tinnitus, but my ENT says ears are perfect. Which exercise would help me? If you have tinnitus, you should work with your neck. You should work with the base of skull. And in my Maxilla course, we're going to work with base of skull also, with occipital bones, with neck, and it's really can help you with tinnitus, definitely. Can we do this maxilla exercise you show today every day? Yes, yes, you can do. Okay. Okay, and I'll show. Okay, in my Instagram also, in my YouTube, I have question. Okay, how to fix tears lines under eye? Work with the skull bones. I thought like I explained completely in this webinar. How? Okay. 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 Okay, do you have some questions? Okay, another questions about hyaluronic acid. I explained. Could performing the maxilla course exercises have an inflammation or redness heat effect on the skin? As I've been asked not to do anything that causes redness or inflammation in skin. No, you have like you will improve blood circulation, and you can like you'll get maybe like in some cases like some like red cheek, but it's accompanied with a good circulation, but it's not inflammation. It's not for inflammation. Okay, my friends. Yes. It is pleasure to meet with you today. And I think we are going to finish our webinar. Yes. Yes, and I would like to wish you health, beauty, success. Thank you very much for sharing your knowledge. Much appreciated. Pleasure to meet you. Thank you. Yes. Sorry for my English. My English is not perfect, but I tried. Your English is too good. Okay, thank you so much. We understand you very well. Yes, it's for me. It's very important. Hear it, really. We understand perfectly. Nice, nice. Okay, okay, okay. We will continue, and I recommend come to my next webinars in the future. How to be your student? It's easy. Come to my faceplasty club and start to do exercise. And I have also professional courses. If you would like to get a new specialty, yes, professional courses, and where it's like instructor courses. I have one. Yes, and I conduct a hands-on seminar also, like in Dubai. Yes, and you can come when we offer a new course, like professional course. You can come to me, or even you can learn online also in my academy, like in professional courses also. But it's more, it's like more longer courses. It's longer courses. It takes a few months and more. Do you have online professional course? Yes, I have online professional course where we preparing coach, like trainer, like faceplasty trainer, faceplasty coaches. Yes, like Victoria. Victoria finished this course many years ago. It was maybe 7-8 years ago. Yes, and I do it. Yes, and in my academy, in current moment, like now, like studying hundreds peoples in my professional programs. But now we do it mostly in Russian, and now we start to do it in English also. And many people from other countries, from US, from Europe, would like to study in these courses because it's unique courses, and natural faceplasty techniques. It's I created this course, and I teach with my team. Is a trainer in Germany. I teach now in Dubai. Yes, but in my online professional programs, you could study from everywhere, from Germany, from French, from anyway. Okay. Have a good evening. Have a good day. Okay, I will come to Dubai to study at your academy. Yes, Iman, come to me. Yes. Can you send the link for the academy? Go to my yes. You can. I recommend go to a website, the faceplasty club's website, and I recommend follow me in Instagram and YouTube channel, and wait. Yes, we offer a new professional course, and later it's whom want to get a profession.